These are pathways that have now been established, and it appears that intermittent fasting isn't just modulating these processes, but is actually having a direct effect on the mucosal lining in a way that favors a healthier gut microbiome. So it should come as no surprise that many people who experience gut issues benefit from restricting their feeding window to 8 hours or so per every 24-hour period. The other very exciting finding about intermittent fasting is the proliferation of so-called non-alcoholic fatty liver disease. 30 years or so, non-alcoholic fatty liver disease was exceedingly rare to see in the clinic, except in alcoholics. Fatty deposits in the liver are bad. It is essentially liver disease. Nowadays, children and adults are showing up with non-alcoholic fatty liver disease. Some of these people are obese, others are not. But it's a serious health concern, and it's growing in numbers all the time. A recent study that was published in Cell Reports Medicine tested the hypothesis whether or not the gut microbiome or so-called brown fat tissue is impacting the liver health and in particular non-alcoholic fatty liver disease. The short takeaway from this study is that contrary to what was previously thought, the gut microbiome, while very important for a number of other processes in the body, doesn't seem to be related to this non-alcoholic fatty liver disease. This is surprising to people, or should be to those of you that have been following the gut microbiome literature. However, brown fat seems to have a direct correlation with the lack of non-alcoholic fatty liver disease. What this study showed was that in people that have diminished concentrations of brown fat, there is a higher probability of having non-alcoholic fatty liver disease. Now, the good news is brown fat stores can be increased. And again, this isn't going to create blubber of brown fat. This is going to create increased thermogenesis and actually make people leaner. And brown fat has a number of other important positive effects. Now, this is interesting because cold exposure of anywhere from 1 to 3 minutes, 2 or 4 times per week, or maybe even 10 minutes, 2 to 4 times per week, can increase brown fat stores. Also, time-restricted feeding has now been tied to the density of brown fat stores. So time-restricted feeding also seems to positively increase brown fat stores, probably because of the way that brown fat stores relate to epinephrine and adrenaline, which tend to go up when we're fasted. What does this all mean? This means for sake of liver health and for sake of reducing or maybe preventing or even potentially, I want to underline potentially, reversing non-alcoholic fatty liver disease, time-restricted feeding also appears to be beneficial.